Good afternoon, everybody. My name is Louise Cathro. I'm the Program Manager for the High Volume Transport Program. Thank you very much for joining us today. Please, if we can just ask everybody when you're joining to please keep your cameras off and keep your microphone on mute, just to prevent any interference with the other speakers. For your information, no slides are going to be shown during this webinar. Closed captions are available at the bottom. There should be a CC, 2 letters in a box, or if you click the 3 dots with the More button, you should be able to either turn on subtitles or activate the closed captions. We've also dropped a link into the chat box for stream text. If you wish to view the captions on an alternative device, you can do so using that stream text link. So we're very pleased to welcome you to this webinar today. This is specifically featuring our Inclusive Access Network. And this network arises from panel members that participated in the Foresight Session on Disability Inclusive Road Transport that was held at the PIARC World Road Congress in October 2019. The session was organised by the HVT programme on behalf of the UK Departments for Transport and International Development, and received the award for the best session of the Congress as voted for by the delegates. If you're not familiar with the HVT program, it is a 5-year applied research program which is funded by DFID and focuses on national and regional transport corridors and cities in low-income countries in Africa and South Asia. Inclusion is one of the 2 main pillars for the HVT program, and it's very high in our priority ranking, and we strive to ensure that social inclusion is integral to all of the research that we do. Over the life of the program, a number of initiatives have supported DFID's efforts to ensure that no one is left behind, as well as organising the Foresight Session in Abu Dhabi. We've also published a policy guide on disability inclusive public transport, a document intended for policymakers. We are currently updating Overseas Road Note 21, a document that helps technical experts design transport infrastructure that is inclusive and accessible. And we've called for proposals for research suppliers to provide us with innovative research projects that can improve inclusivity of transport systems in the global south. COVID-19 infection rates have been slower to peak and are now on the increase in low-income countries. This webinar aims to highlight the challenges that are faced or that comes with increased mobility during COVID-19, particularly for people with disabilities. We want to understand the issues that they face, and what needs to be done by policymakers, road authorities and transport operators to ensure that transport and transport infrastructure is safe and accessible for everyone in low-income countries. Measures are being put in place to help or to prevent the spread of the infection, and whilst many of these are well-meaning, unless they take cognizance of all people involved, they could end up doing more harm than good. In preparing for this webinar, I was quite surprised to hear about the many ways in which people with disabilities are affected by measures that are put in place. Situations that may be part of everyday life, which we take for granted, take on a very, very different perspective when your lived reality is different. Supporting low-income countries by learning from others is at the heart of HVT activities. I hope you enjoyed this webinar today. I'm sure you're going to find the perspectives from our speakers very interesting and thought-provoking. We want to hear thoughts from our audience as we seek to capture the ideas, the gaps or initiatives that could benefit our low-income beneficiaries or spark off new research under the HVT program. There will be a chance for Q&A from participants after the main presentations and discussions. You can type your questions into the chat box. You can also use Alt-H to enable the chat box. We are recording this webinar, and a link with the recording and some notes from this will be shared with all attendees and will be published publicly on the HVT website. The webinar today, we're aiming for this to run for 90 minutes, and we will attempt to address all questions that are raised, but if we're not able to do so, we'll pick these up in the summary notes that go out. So thanks everybody for joining, and I'll hand over to Anne. Thank you.
Thanks, Louise. Again, welcome. I'm Anne Frye. I'm an independent consultant on the mobility of people with disabilities. I've over 30 years experience in this field, both in the UK and internationally, and I'm delighted to be moderating today's webinar. We have registered about 140 participants from about 40 countries around the world. So this is clearly a topic of huge importance. My apologies to those of you who've had to get up very early or stay up very late. The beauty of not having your cameras on is that those of you still in your pajamas, we've no idea. So, as Louise has said, the focus of today's webinar is mobility issues facing people with disabilities as we move through the COVID pandemic at different stages in different countries, focusing, I think, on a lot of topics, including what social distancing means for people who need physical assistance, for people who can't see, what we can do to mitigate infection risks, what we can do to deal with the fear that many people find actually about going out and about in these days, and the fear that a lot of people who would otherwise be assisting people with disabilities are feeling, and therefore are not coming forward to give that help. We'll look at what the issues mean for people with physical disabilities, with cognitive, sensory, and other needs. So a very wide-ranging discussion. And we're going to look in particular at what future solutions might look like. The format for today, we're going to hear first from two speakers, both with lived experience of disability as well as professional expertise in those fields. And then we're going to move to a panel of three experts who will talk about emerging solutions and options. And I'll introduce them as we go along. So I think let's get going right away and call on our first speaker. Samuel Mani is in India. Samuel is an entrepreneur, but he is also the head of an NGO called Yes We Can, which is a group formed by individuals with a range of disabilities to promote independent living. And Samuel is a wheelchair user. Samuel, if you'd like to turn on your camera and microphone and give us your thoughts. Thank you.
Hi, thank you so much, Anne, for inviting me to this webinar. I'm very honored, and well, let me start by saying that this time of unusual circumstances has brought a realization to non-disabled people how a person with a disability feels when they are in their homes, in their houses. So, as I said, in earlier times when I started up my business, the concept of inclusion and especially accessibility was not a very well-known concept. It is only after the new government in 2014 which came in, which introduced Accessible India program and awareness about accessibility became more in the mainstream. So the bigger towns like Delhi, Mumbai, Chennai, they are working towards accessibility. It has yet to reach the smaller towns. But I must say that even in Delhi, there are areas where we do lack infrastructure facilities. Now coming to the point of COVID. During the COVID, I would start from during the COVID period. During the COVID period, I was in my house, and I and many of my friends who are members of Yes We Can uh, were in a precarious situation because, as I said, accessibility is yet fully made in Delhi. So what happened is that, like, getting the money from ATMs became very difficult because people were afraid to go, and helping a person with disability became even more, you know, less priority for them. So we literally had to ask, or, you know, emphasize, please help us. Similarly, I can give you an example, like, um, we wanted a supplies, rations from our grocery store, and he refused to bring us the supplies. But before the COVID, he used to bring to our home, but now he stopped. So we literally had to uh, ask my friends who were lawyers to not threaten, but to say that if you don't provide the rations, then we will file a case against you. And that's how we got the rations. During the COVID lockdown time, there was one more incident that happened to one of our members. I would like to give that instance. Uh, One of our members who got infected with COVID had to be relocated to a isolation camp. Now, in the isolation camp, there was no wheelchair available. There was no accessible toilets or anything like that. And she contacted us saying, how will I survive? You know, they don't even have bathrooms where I can go. So we asked the Commissioner of Disabilities in Delhi, and after a long time, he managed to get her transferred to a government flat which had a bathroom, not an accessible bathroom, but at least a bathroom and a wheelchair. Now, now our country is going into unlock. The main, uh, the main problems that I find and I see happening is the lack of uh, getting help from people because they are already in hypersensitive mode. They don't like to touch anybody. Now, a person with a wheelchair or a visually impaired person requires help at many points, either physically in terms of holding hands or getting out of the wheelchair and transferring. These problems are getting more enlarged. Me and my wife always travel on our motorized wheelchair, and we travel through metro. Metro is very accessible, but what happens is most of the time the ramps are accessible, but the way to the ramps are blocked by parking, or uh, the way to a metro station is not very accessible. By that I mean they are either covered with potholes, which becomes very hazardous. Like in this rainy season, water is filled up in the potholes, so we don't know where we are going. Either we are going on the road or there is a pothole in front of us. And before COVID, we used to find many people who used to come forward if we are about to fall, or if we are getting imbalanced. They used to just give us a hand. But now I find that they are afraid even to touch the wheelchair, which is very difficult. As and ma'am told you that I have an NGO, and our NGO works for uh, independent living, and we believe our first step is to bring out people of various disabilities, and so that they are visible in the society. This was done through various volunteers who used to bring people on metro uh, to our events. But now it is very difficult to find volunteers because their family is pressurizing them not to go out, not to help, because the virus is contagious and they might be prone to it. So that is another problem. So the people whom we had brought out after such an effort are again stuck in their homes, and they are uh, calling us and they're saying that we are now again in the same position. Next point I would like to make is that usually in a family where a person with disability is, the family doesn't want to spend much money on him or her. This is because um, they have already spent a lot of money on the hope that they might get normal again, but of no use. So now when the family earnings itself has become less, they really don't want to spend more on a person with disability. As far as my being an entrepreneur and being in business, I know many of my uh, friends who are like me, who are doing small businesses. Now they need recapitalization, but they can't afford to take loans because, first of all, bank managers are not very keen on giving loans to a person on a wheelchair or person having a disability, because they think that how will he or she will pay back my loan. So they don't give loans. If they give loans, then it is very difficult for a person who is having some kind of disability to explain to them that, look, I need time to set up the business again. So it's a very complicated situation in those terms also. I feel that many of my members are entrepreneurs who are doing small businesses. Either they are selling handkerchief or they are selling small items. And now when they are not able to earn, it is very hard for them to ask for help because there is only limited amount of money which is provided to a disabled person as help, because disability is a state subject in India. So each state has their own policy regarding disability, and the disability pension, as it is called in India, varies from 200 to 1500 rupees. 1500 is in Delhi. So, and that too, it is given to people who have disability certificates. Unfortunately, out of the whole population of disabled people in India, only 33% of them have disability certificates. So the rest of the people who have disabilities are left out of the social security altogether. My suggestions and my thoughts are that in COVID times, especially when people are so hypersensitive towards touching, towards handling, think about a person with disability who is alone or who has a caregiver. If the caregiver is not willing to help, then it becomes very difficult for him or her to live his life, to live their lives.
Samuel, I don't want to interrupt you, but we need to move the discussion on. But that's been a brilliant insight into what the issues are in India and some very disturbing facts that you've given us there. We'll come back to you during the questions and discussion if we may, but for the meantime, thank you so much for an extremely interesting start to our discussions. I'd like now to move on to our next speaker. Crystal Asige, who is in Kenya, describes herself as a musician, a YouTuber, an accessibility auditor, and diversity and inclusion consultant. Not much going on there, Crystal. And Crystal has a visual impairment. So can I invite you, Crystal, to speak to us now? Thank you.
Thank you. And thanks so much for the invitation. Again, I'm really happy to be here to share my experiences and that of the PWD community in Kenya as well. I'm going to split up my quick presentation into three main parts that I'd like to share and discuss. And then the last part will be just a few questions that are flying around in the disabled community and questions as well that come from a conversation that I've been having with engineers, planners, and designers over the Corona period about what they think is in store for us as the PWDs after Corona and after reopening. So number one, As we all know, around the globe, we've been given 3 main mitigation measures, which are wearing masks, washing our hands or sanitizing our hands, social distancing. Those are the big 3, let's say. Since the 6th of July, the President of Kenya has announced reopening of city-to-city movement. Basically, for the last 100 days before the 6th of July, we were not allowed to move from city to city under any circumstances. And so it was only within the city you were allowed to move around if you needed to. It was essential. And since the reopening on the 6th, there have been corona cases to now 14,800 as of yesterday, with 260 deaths in Kenya. So what are the problems that we're facing here as a disabled community now that we have reopened? First of all, in the visually impaired community, myself, of course, included, there are issues with guiding. When I need someone to assist me now, when I need to go out, usually I would grab onto their elbow. But unfortunately, we have been told to sneeze into our elbow to help stop the particles from floating around and infecting somebody else in case we have corona. So that, of course, is a direct challenge for us, because where do I grab onto to feel secure and to be guided by somebody? Another measure is that we have been given the option of folding our white canes into half, whereby I hold on to one side of the white cane and then my guide holds on to the other side of the white cane. And that's how we would be able to move around, and he or she would be able to guide me. But of course, that means that I would need to be very vigilant on cleaning or sanitizing the white cane. And so far, there have been issues with space, because already our pavements are either very small or they're not existing at all in some parts of the streets. And other pedestrians find it quite irritating when they have to bump into us, or they have to give us even more space. And there's a conflict there as well in general with the general public. Also, another measure is to wear gloves, but unfortunately, as a visually impaired person, my fingertips are basically my eyesight. I need to touch things to understand what they are. And wearing gloves, obviously, does not help in tactile feedback at all. Persons with cognitive or intellectual disabilities, for example, those with dementia, are finding it very difficult to remember all of these guidelines, because today there are 3, tomorrow there are 5, the next day there are 10 different rules and guidelines and things that they need to remember. And those with cognitive disabilities are finding it quite difficult to organize their thoughts and memories as to what is important and what has been said most recently to adhere to. There's also an issue of alienation and more aggressive social behavior from the general public towards people with disabilities. Another example that is being, as a challenge in the VIP community, is people guide dogs or service dogs. Guide dogs, unfortunately, haven't been trained in COVID issues, in COVID matters. They just know that they need to take Crystal from her doorstep to the shop entrance, and that is their job, and that's what they do very well. Unfortunately, now we have to queue up outside because numbers are limited inside any establishment, and in the queue we have to be socially distancing. And unfortunately, dogs don't know that. Guide dogs don't know that. So the public are obviously giving us the queue and get to the front. Doesn't she know that we have to social distance, etc., etc.? So there's more aggressive behavior just socially. Also, local buses and trains and flights don't have the technology or the capacity to adhere to these mitigating measures. Unfortunately, there are reports of buses that are traveling for even 8 or 10 hours between city to city, which are still having passengers sitting next to each other. Buses which don't have the ability to crack open a window for air circulation and so on and so forth. So that is a very big issue as well that we are trying to figure out in Kenya. Also, another beautiful thing that's been happening across the world, I'm sure, but definitely in Kenya, is goodwill donations. But unfortunately, these goodwill donations have pickup points or locations that are inaccessible to PWDs, be it the actual building itself or the connectivity or the route to the pickup points. So unfortunately, there are only two options for PWDs, which are either to struggle to get there on their own or with a caregiver, or to just miss out on the goodwill donations altogether because we cannot get there physically. There is a 9 p.m. curfew as well. Before the 6th of July, when we reopened, it was 7 p.m. curfew to stop people from congregating in nightclubs and at bars and cinemas, etc. All these evening activities, which is a good thing. And now it's eased to 9 p.m. But unfortunately, this still poses a really big challenge to us PWDs because there is a massive rush between about 7:30 p.m. until 9 p.m. People going home in a rush, and we get caught up in that rush. And now that there is Corona in the mix, people, like Samuel said, are less willing to help or volunteer to help somebody with disability get into a bus or get into whatever transportation they need to get home safely and on time. So there is an extra fear, and really, to be honest, that's something that we have not been able to tackle yet. Also, walking into any buses, local buses, the government and the Ministry of Health have said that all bus touts have to provide sanitizers to any passengers walking into the bus. But unfortunately, because these sanitizers are quite expensive and it's difficult for them to keep buying them, they're about 800 shillings, which is $8 approximately. For the small ones, the ones that are just pocket sized. Because of that, they are resorting to making homemade. Albino community especially are complaining that these homemade sanitizers, which usually consist of water and bleach or water and alcohol or some kind of spirit, they're saying it's affecting their already sensitive skin, and they're looking for ways to help them through this particular challenge. Also, now, though it's summertime in most Western countries, it is said to be winter time here in Kenya and this region, which means that it's going to be a very rainy and and this usually, when it rains a lot, already it causes a problem with people walking around, running to try and get to bus shelters which have good coverage and are wide enough for everyone to stand underneath, etc. And so this is also going to be has already caused a problem and will continue to cause a problem because of the lack of good shelters and places to shelter people from the rain. And with people with disabilities, we already walk a bit slower, we move a little bit slower already, and so it's causing a problem. Personally, I have walked out of a matatu, which is what we call our bus, our local buses. Walked out of matatu, they have dropped me a place that isn't the correct bus stop or isn't the correct route to get to a bus stop. And I have walked out and fallen straight into an open manhole, which has been covered by puddles because no one can see what's happening when it's raining so hard. And that's obviously a massive challenge, and it's dangerous in general. So my second point is around accessibility agenda. I think that this is a really unique opportunity for designers, planners, construction companies, etc., to design for infectious diseases. And also, while doing so, try and put into place these accessible designs and universal design in general at this particular time. I think this is a really good time to advocate for more spacious or outdoor spaces. Number one, for example, wider pavements. I don't know where we're going to get space for wider pavements, unfortunately, but this is a good time to advocate for them, for better bus shelters, for more spacious transit hubs where you get your matatu or you get dropped off by your matatu, so on and so forth. It's a good time as well to advocate for mixed-use neighborhoods, so that as a PWD, I don't have to travel 30 minutes to the west or 30 minutes to the east to get to my local amenities. Maybe my neighborhood could have everything that I need, and so I won't have to worry about traveling around and getting infected by the virus. Also, it's a good time as well, I think, to advocate for more COVID-friendly materials. We have been told through many reports and research that there are surfaces that are less conducive to the virus, that are better rather for the virus. This, I think, would be a good time to try and use these materials and technologies. For example, touchless doors to get into any establishment, which I'm sure some of you have seen in the West, in Western countries, but unfortunately they're not here in our context yet. Touchless doors and lifts and so on and so forth would be really useful. And also within buildings and just within, for example, parks and any open spaces, to have more spacious spaces to encourage social distancing. I think Samuel already spoke about transit hubs, the issues within transit hubs, metros, and where you would get your local buses regarding, inaccessible features, which were already a problem before COVID, but now are even more of a problem for PWDs. Also, it's an opportunity for retrofittings and refurbishments. For example, why don't we have buses or matatus, as we call them, whereby you walk into one door and walk out of another door, so that you lessen the contact of people brushing up against each other when they're trying to exit or enter a matatu. And also, finally, in this point, it's a really good time, I think, to advocate for policies which force or rather heavily encourage policymakers and any designer or people in the sector regarding the built environment and transport environments as well, to make sure that they have PWDs and disabled persons organizations available and within the project, rather, from conception all the way down to implementation, so that we can make sure that they are doing what is right for us as well. My third point is on working from home. So Mark Zuckerberg was recently recorded as saying that this is a really good time for opening up the pool of talent for any organization, because you can now just go online and work online and have people from anywhere remotely working for your organization. This is positive, I think, because PWDs now have a bigger case to present to their employees about working from home, which has always been a big fight within the PWD community. We feel we should be able to work from home. Why should we have to travel to go to work? And this means that we don't have as many opportunities as the non-disabled. But now it's a better case that we can put to employers. But at the same time, this means that employers need to become more conversant and educate themselves on accessibility, on inclusion, diversity in the workplace, as well as assistive technologies for PWDs or anyone who needs to work from home that needs a bit of a helping hand in accessible technologies. It's also positive what Zuckerberg said, because there might be a decrease in travel for PWDs in general if we are able to work from home. But this means that we will be lacking in social interactions, and which might impact our mental health in general, because already we suffer as a general rule, PWDs do suffer more in confidence and self-esteem. It's also positive what Zuckerberg said, because you don't have to now work in the city that you live in. For example, this particular webinar, we'd have to meet all, but we're doing it online, which is a good thing. But unfortunately, I feel that if we are no longer seen or heard outside in the environments, if our voices and our concerns and our needs are not listened to within the wider general public, then I feel that all the steps that we've been taking in disability awareness and so on and so forth will be taken back several steps, unfortunately, because I think the public need to see us. They need to see us and hear us and understand our needs in order for the disability agenda to move forward in any kind of way. So this is where I will ask Anne to put up my questions, maybe in the chat box, if you can maybe copy paste them just for stimulation, for discussion, and maybe even for anyone to think about after this webinar as well. But thank you very much for the opportunity. I feel as though, as well, my final thought is that even though we are told to social distance and it's a help for COVID to not spread as quickly, for PWDs, we're not just social distancing, but we are, I feel, being left even more behind, and we're socially being distanced even further from the general public because of the COVID-19. Thank you very much.
Thank you very much, Crystal. There's some extremely interesting points there to get our panel going on. I think you and Samuel have raised some very, very important issues. I'm now going to turn to our extremely distinguished panel. Let me introduce them briefly. Professor Nick Tyler from University College London is Professor of Civil Engineering, and Nick has worked globally on creating an accessible, adaptive and sustainable urban realm which is responsive to all people and their needs. Dr. Margie Pedden is Head of Global Injury at the George Institute in the UK, but has also worked for many years for the World Health Organization, and she's recently co-authored a paper on transport and health during and after COVID. And our third panel member, Dr. Joseph Kwan from Hong Kong, is Deputy Vice President, Asia Pacific of Rehabilitation International, and has been the Global Chair of their International Commission on Technology and Accessibility. He's also the founder and managing director of his own Universal Design and Accessibility Consultancy in Hong Kong. So a pretty impressive bunch, I think you'll agree. Let me start, perhaps Nick, with you. We've heard a lot about fear about risk of infection, about what can be done to address some of the concerns. What would be really good in this session is if we can start to maybe dispel some of the myths, but also to come up with some positive solutions that might be appropriate in low-income countries and elsewhere. Nick.
Here I am. Hello everybody. Thanks very much, Sam and Crystal, for really interesting talks. And I think this is a really big problem for everybody, but it's an even bigger one for people with disabilities, because I think for a number of reasons. I think Crystal mentioned, or Anne mentioned, the question of fear of people, and I think generally speaking, one of the things that COVID has done is made everybody a bit scared. And I've got very cross over the time because of this expression of social distancing, because I think actually that is a big mistake to talk about social distancing. We need physical distancing possibly, but social distancing is not a good thing for all the reasons that we've heard. People become isolated, people become lonely, we get increases in mental ill health problems because people feel isolated because they can no longer meet in the way that they were used to meet before, and therefore we have a big problem. So as soon as the government comes along and says you must socially distance, what that is saying is go and isolate yourselves. And actually we need, in a time of great difficulty like a pandemic, the last thing we actually need to do is isolate ourselves socially, even if we have to learn how to do that while being more physically distant. And I think that distinction is actually really important. And when we think about people with disabilities, that becomes crucial. We've heard some examples this afternoon of people not being able to get help when they needed it because people are scared of approaching them. And we've had examples of people finding it difficult to be guided by somebody because the usual way of guiding somebody by holding onto their elbow, for example, completely conflicts with the advice for people to sneeze into or cough into their elbow. And that, you know, is it possible to create answers to that? Well, it's difficult because we are talking about habits, and we're talking about I think most governments I have seen have been incredibly unclear in any guidance. They change it a lot all the time. We've heard from Crystal about the problems that gives for people with cognitive difficulties. So the lack of clarity, which is partly because people don't understand the virus, but it's also because they don't really know what to do. So we've been doing work with this in London, primarily on buses, because we have a very high mortality rate of bus drivers in London. Personally, I don't think it's because they're bus drivers, but the bus drivers come from a part of the population with a lot of risk factors that affect COVID, or are made worse by COVID. And so they are in a group which is high risk. But we've had to reassure bus drivers in how we can redesign the bus in order to protect them. Otherwise, we have no buses. Now we are working on the passenger areas of buses to figure out how to make those more protective for passengers. And that generally means increasing ventilation. Yes, it means cleaning, because the virus gets transmitted on droplets. This is why the problem of distancing comes up, because when we breathe, when we speak, but when we sing and when we cough and when we sneeze, we these droplets over a distance, and the virus sits on the droplets. And so within a meter or so, meter and a half or so, the larger droplets fall to the ground or onto a surface, so we have to clean the surfaces. But small droplets will just float in the air. And so ventilation is a really, really important thing to have, because that will help to disperse the droplets in a way that we don't actually catch enough of them to be able to contract the virus. So ventilation is really good. Outside is really good. Crystal talked a lot about open spaces being a good idea, and she's absolutely right. So if we can actually create the environment in which the likelihood of contracting the virus decreases by things like more space, ventilation, using the outside spaces more, getting better ventilation, that's a really good thing. And that makes life a little bit easier for how we're actually going to deal with it. I think we need to think about this. One of the reasons why masks are often encouraged is because it reduces that emission of those droplets. The problem with masks is that they also mask lips, so it's difficult for people to understand what people are saying sometimes, and it makes it difficult, and sometimes it feels quite constraining for some people with some conditions. It's difficult to wear a mask, so masks are not a perfect solution, but they certainly help. And where people can wear masks, they certainly should, because that does reduce the amount of transferability. But they are not a perfect solution, and we need to find ways of enabling people to be able to move around even if they cannot actually wear a mask. All of this gives us a big set of challenges. I think, and Crystal alluded to this, and also Sam alluded to this earlier, part of being a human is social. It's about how we communicate with each other. And people with disabilities sometimes have that as an added challenge to their normal life. But actually, sociality is the core of being human. And I think over the last years, we have lost that quite a lot. And COVID is a great risk of losing it even more. But on the other hand, it's actually an opportunity of figuring out how we increase sociality. How do we actually enable the community to come together more in this difficult time, and not just simply create ways of keeping them apart? And that is going to be very, very important. And that means we have to understand about proximity, about how people need to come together to assist other people. And how can we actually educate people not to be fearful of doing that, by being able to be clearer about what is needed and what is not needed, and how that will actually work, so that actually people help each other rather than stay away from each other. I think that one of the generic problems is that problem of fear, because that will cause people to stay apart. I think another generic problem is really poor information. And I'm pretty scathing of the government information that I've seen from various countries around the world. It is really poor. And not only is it poor, but it is changing. So it's poor because it's poor, and it's poor because it's changing. And I think these are things to do. And I think governments actually do have a role here as being the leaders of society, whether we approve of the government or not. That's where they are. And therefore, they need to realize their responsibilities to everybody in society, that they need to be honest and clear, and they need to say things that are credible, so that people can then take that as the leading guiding message and then be able to act properly with other people. I think they need to ensure that everybody understands the needs of people with different capabilities, so that people understand what people with disabilities need, and understand how to find out what the best way of helping somebody is, which is generally, in my experience, to ask them. And how do we actually deal with some of the bigger questions? Why do people have to rush home at the end of a day at work? Why do we have to have peak hours? Well, maybe we should start to think about how the world of work might change to reduce those kind of pressure points in our cities, so that we don't have to have people crushed into vehicles, matatus or metros or buses in huge densities, and therefore at very high risk of contracting infection. And I think we need to encourage people to be social and to use sociality as part of assistance.
Okay, sorry to interrupt you, Nick. We've got a lot of interest coming up on screen. Just before I move to Margie, can I remind everybody you're very welcome to ask questions. Use the chat facility, please, if you can, and we will do our best to address all of those questions either during the webinar or afterwards. Please let us know who you are, and if your question is for one of the speakers or panelists, please just flag that up so we can do the most effective things. Margie, can I turn to you and ask what innovative measures are being trialled to try and address some of the problems we've been hearing about?
Thank you, Anne. Yes, this is really an important and critical area for us to look at. As you mentioned, I've recently written a report looking at the nexus between transportation and health, and certainly COVID has shown or has highlighted the big divide. Whether that divide is race, gender, economics, or ability, it's certainly shown that up, and it's shown how poor the linkages are between transport and health. You know, we talk about these issues as being multi-sectoral, and yet in operation, it's very seldom that sectors talk to each other. But I wanted to just make 3 points. The first point being that the public health and environmental measures are critical for everyone, whether we are able-bodied or whether we're disabled. And really, there is a need for a holistic approach to this. I've been talking on other webinars, and some people focus on infrastructural changes, some people focus only on environmental changes, other people put the onus very much on the individual and look at behavioral issues. I think it has to be addressed in a holistic manner. Yes, we all need to reduce unnecessary trips. Yes, we do have to reduce infected people getting on public transport, for instance, but we do need to offer alternatives, and I'm sure that Joseph will talk about this, but we do need to offer accessible and safe alternatives, walking, cycling, etc. We have to look at repurposing the streets. We have to look at speed enforcement. One of the things, as a road safety specialist, we've certainly seen in many countries during the lockdown was because that there were so few vehicles on the road, vehicle speeds increased, and that puts a huge risk on vulnerable road users, whether they're able-bodied or not able-bodied. So looking again at policies around speed enforcement, but addressing all of these together. And I think that my second point is around adapting these public health and environmental measures for people with disabilities, whether those are cognitive, whether they're sight, hearing, or silent disabilities. There are many people who look like they're perfectly good and well, but may be walking around immunocompromised, etc. So I think that Crystal has highlighted a couple, and Nick also highlighted a couple, masks being the big one at the moment. There's lots happening on Facebook around how a mask does not reduce your oxygenation, because people are saying, no, I can't wear it because I faint or because my blood oxygen goes up. Physiologically, that's not possible, but what we have to think about is that there's so many people out there that have mental health related issues, panic attacks, for instance. So how do we get around this? I saw a lovely young lass being interviewed on TV the other day who actually wears a badge that says, I am face mask exempt, because she has an underlying mental health disorder. So I think that it's really important to look at some innovative adaptations. The other issue, Nick and Crystal and Samuel have brought up many of the issues that we need to look at. But the one that I wanted to highlight was around messaging, and Nick did touch on this. Yes, the messaging is constantly changing, but the messaging is also primarily visual. Whether it is signs outside, whether it's television adverts telling us what we should or shouldn't be doing. And so I think that the messaging has to dispel some of the myths, but it also has to be far more adaptive, and we need to think of other ways of getting the messaging across. There's some other things, like I just went into a shop earlier, and on my way in there was a hand sanitizer. It was behind the flower stand. It was difficult for me as an able-bodied person to get to that hand sanitizer. So we really need to educate the population in that messaging about being inclusive. But my third point that I want to make comes to the issue of policy changes. And the one policy change I think that Crystal didn't mention that I, as an academic, am passionate about, and that is research has to be inclusive of methodologies and study designs. Data has to be analyzed, including the experiences of people with disabilities. I like to say that if you can't measure it, you can't manage it. So in the situation that we're in at the moment, around transportation, around people with disabilities and COVID, if we don't have the information and we don't have the evidence, and the researchers can't propose policy changes to the policymakers. So I really think that we need more information, and I welcome the HVT grant program around this call around transport and disabilities, because I think it will provide us with an opportunity to hear from people with disabilities, to look at case studies, to develop the evidence so that we can propose inclusive strategies. Thanks, Anne. I think I'll leave it at that point.
Thank you so much. We've got some great questions coming up, and we'll turn to those in a moment, but I want now to go to Joseph, and in particular, Joseph, ask you about some of the suggestions that Crystal in particular made about the built environment, the way in which we can improve the conditions for people moving about in these times.
Good evening. Thank you, Anne. It's very interesting. It's very complex. In fact, the issue of accessibility. what I see is, there's different stages and different levels. We're talking about an environment which we need to address it from the macro environment right down to the micro environment. And the other factor is we need to look at the hardware as well as the software. The hardware is our built environment, which includes many, many things we need to address. The built environments, which are the physical buildings, and within that, we talk about people interacting within built environments, places like offices, workplaces, manufacturing, and all this goes at various levels. In terms of people mentioned about the parks and open spaces, wonderful, and we need to make those easily accessible. And how do we talk about later on about the social distance or this aspect? Transportation obviously is a huge issue, whether it's trains, trams, buses. We have minibuses, taxis. Recently, we've had 5 or 6 taxi drivers that were infected, and they, without knowing it, and people go in those taxis are actually part of the spread. So these things are, in terms of transportation, infrastructure needs to be looked at. How we need to improve on that. The use of ICT, information communication technology, how to make things easier, accessible format for people to read and understand, whether it's visually impaired or hearing impaired. And then, like I said, these are the various levels of we need to address and deal with. I think it all boils down to what I'm hearing now. Basically, 2 things I'm hearing. We may be looking at an environment that's preferably less and less touchless or hands-free. So rather than providing buttons for the visually impaired to press, we have lots of lifts and buildings are 30, 40 stories, and the visually impaired rely on the touch to feel these buttons, which are tactile, and to press the floor to go up to various levels and floors. So with the COVID, the one way to do that is to sanitize all this by they now put down over plastic sheets over this. They say they can wipe this quite easily over within an hour. But this makes it very difficult for a visually impaired person to actually feel the tactility of those lift buttons, for instance. So we need to find out solutions, how to deal with that. Crossing the road, we used to just press the buttons to cross the street, but now it's going to be much harder. I was thinking, if we don't touch it, someone already mentioned things has to be automatic. Another solution is maybe use our feet. Okay, we don't touch things, we use our feet. The buttons are now lower down on a set of buttons. It's one up higher, like a bit lift buttons, and some are lower down at the feet level where we use our feet to do that. So all these things need to be dealt with. And I think we are now designing for a new environment, the new paradigm everyone needs to look into, from planners, architects, transport operators, transport designers. We need to look at the new paradigm of being things that preferably minimum of touch if necessary, and to design according to Nick, not for social distance, but for physical distance. And that goes into our office blocks, into using lifts and elevators and things. So this whole level of interest and challenges we need to go into. So that's a very quick, broad overview of things. I'll leave it at that for a moment. I'll leave it for the audience to have questions on that. Thank you, Anne.
Thank you very much, Joseph. We do have some great questions up here. We haven't got a huge amount of time, but let's crack on. Luca, I think you're going to introduce the questions.
Yes, hi everyone. So yeah, very interesting questions. Some of them can be joined together. The first one is about education of the public, and it's from Hussein Patwa, an individual consultant to the Scottish Government Mobility and Access Committee for Scotland. It's a question for either Crystal or Samuel, and he is asking, how do you feel the public can be best educated to the needs of people with disabilities so the stigma is reduced and they can be best included in society whilst maintaining health measures?
Okay, let me turn first to Crystal. Can I ask everyone please to respond very briefly so we can try and get through the list of interesting questions. Crystal, do you want to pick that one up?
Yes, can you hear me?
Yes, can you hear me? Yes, can you hear me? Yep, You need to unmute again, then go ahead. That's it.
Okay. So the first thing I would say is definitely.
Okay, hold on a minute. We've got a problem there with.
Can you hear me?
We can now, yes.
Okay, so I was saying that the thing for me, I think, is definitely the media. The media is a massive and it's a very powerful medium or tool to use, especially in educating people, the masses rather. So radio and I think TV need to find better strategies on how to, like Margie was saying, make all the information more accessible, easy to understand, and to be able to go as wide and as far as possible in terms of how they present the information, the messaging. Definitely for me as a creative as well, I found that my videos on YouTube and all the things that I do, etc., online have been much more poignant in terms of spreading awareness than anything else that I've ever done before. So media is a very powerful tool. Seeing people with disabilities on movies, on the news, as the anchor, as the weather girl, as the presenter on radio, things like that, it'll really help.
Thank you. Samuel, this is a really interesting point about how do we make sure that people with disabilities are engaged in the planning for pandemics and issues of this kind, rather than being left behind afterwards. Do you have a brief comment on that?
Yeah, I think yes. If governments are open to take our suggestions, especially of individuals who are running DPOs, who are directly in touch with so many sections of society, and they actually incorporate those suggestions in their policies, that would make a huge difference.
Yeah, absolutely. Thank you, Samuel. Let's move on, Luca, to the next question, if we may.
Yes, so there are three questions that actually are related in the involvement of the people with disabilities in the planning for during COVID, the post-lockdown, let's say. The first one is about how do we better involve people with disabilities in pre-pandemic planning and strategy, and continue this through the reaction to crisis to try and avoid many of the challenges that have been seen isolating people with disabilities during COVID-19 when preparing for the future. Similarly, Luke Beasley, a PhD student at the University of Brighton, is asking, disabled people's user-led organizations, DPULOs, have been vital to representing the interests of disabled people across the world, alongside pushing equality and accessibility agendas within national and transnational governance organizations. Samuel Manny indicated that there are some very real barriers to DPULOs operating, as they have hitherto in India. At the same time, Crystal Asige points out the need and opportunity to push for co-design of government services and broader responses to the pandemic. How do Mr. Manny and Mrs. Asige see the role of DPULOs in policy responses to pandemic? How easy will DPULOs find it to influence decision makers in the current climate? And connected to that, there is a suggestion from Hussein Patwa again. Is basically saying that with so many common themes coming from disabled people around the world, COVID-19 provides an opportunity to bring communities and countries closer together. Is there a possibility of setting up some sort of framework of disabled people from around the world to engage with countries, governments, UN, to ensure inclusion in any future pandemic preparation, management, and recovery?
Thank you, Luca. That certainly sounds to me like a highly necessary step. Which of our speakers or panelists would like to pick that one up? Margie.
Yes, so thank you for all the questions. I mean, I think that this is critical, and it really speaks to the need for participation, but the whole concept of nothing about us without us, the need for participatory research, the need for participatory policy development. As far as developing a framework is concerned, I mean, I think that this is a really interesting suggestion. Now, I will put on my hat as an ex-WHO staff member and tell you that setting up frameworks with governments and non-governmental organizations is extremely laborious, time-consuming, takes years and years and years to develop. And I'm thinking my frame of reference is the tobacco framework that I was involved with at WHO. So I would think of something looser in the interim. I'm not saying that it's not something that we should strive towards, but probably something that is less clumsy, to put it in its most basic terms, at the moment. Some type of global network that pushes forward these ideas, that integrates the need for participatory research with participatory policy development, with involving governmental, non-governmental, people with disabilities, and the NGOs that support them and talk for them in some type of network moving this forward.
Thank you. Joseph, I just wondered whether this was anything that Rehabilitation International might have a role to play. You need to unmute, Joseph.
Sorry, Anne. I missed that, sorry.
No, I just was wondering, this idea of some sort of organisation that makes sure that people with disabilities are brought in at the planning stage, what sort of network could we set up? I wondered whether Rehabilitation International might have a role in that.
I think all along, I think through some of the commissions, actually, we actually have people involved from day one. I think the beauty of the organization is it is multifaceted in terms of different stakeholders. The visually impaired, hearing impaired, and the people with mobility impairment. I think they're brought in fairly early in any of the processes, whether it's education, whether it's policy making, and we have members who actually have a disability. So I think we're brought in at a very early stage, and Rehab International like that. I think we're fortunate to be able to have different representations, if you like, in order to put in something, policies, education, etc.
Thank you. I think this is a suggestion we need to pick up from the webinar and be in touch with people separately to see what we can develop, because it strikes me, I mean, from what Samuel was saying about some of the appalling things in isolation centres that didn't have an accessible toilet or a wheelchair, actually nobody thought about accessibility issues in the planning for how to deal with an issue of this sort.
Also, just quickly, and for everyone listening, there is the International Disability Alliance that is a European-based organization, and they do a lot in what we're just discussing right now. I would encourage people to go and look at their website and see what they're doing, as well as the Global Disability Forum, which had its first meeting convening in 2018 in London.
Excellent, thank you very much. Those are very good concrete ideas we can build on. Luca, do you want to bring us back to questions?
Sure. So there are a couple of questions that relate to planning mobility for people with disabilities during the COVID crisis. One from Janet Jimenez, who represents Access Exchange International. She was asking how, if the panel knows, how generally transportation for students and the reopening of schools has been addressed, especially looking at children with disabilities. And another one specifically for Joseph, from Professor Shafiqur Rahman from Urban and Regional Planning in Bangladesh. Was specifically interested in how Hong Kong have differently tackled the COVID-19 apparently successfully, and whether there are any particular insights on how Hong Kong has addressed people with disabilities needs.
Okay, well, let's pick up those two issues and maybe start with Janet's point about students and school children with disabilities. I think we all know how far children have been disrupted by the process in terms of their access to education. Would anyone, speakers or panel, like to pick up that specific point? If not, I think, Janet, I'm going to ask you to speak directly. I'll come to you, Margie, in a moment. And just, if I may, let me just ask Janet very briefly, if you would, to say something about your work on schools and this issue.
Yes, I think, can you hear me now?
Yes.
Yeah, okay. So, well, as many of you know, Access Exchange International has been working on transportation for children and youth with disabilities to schools in developing countries. So one of the current questions is how schooling will return for the next academic year, which may start in August or September in the North Hemisphere. And how are we going to start that in a responsible way? I mean, it might be in person, it might be online, it might be hybrid. However, we know that students receiving special education services may be more affected by distance learning. Thus, they will need to attend school for their programs with social interaction, which Nick just mentioned. And of course, with several implications in the design of the school of spaces and the structures. So we know that there are different barriers for persons with disabilities to travel, as Crystal says, where meeting physical distance guidelines and protection of health is a challenge when using different modes of transport. But we know that public transport in some places have been reduced and that there are neglected issues of school transport, especially for children and youth with special needs. In Mexico, a national emerging mobility plan has been published a few weeks ago due to COVID-19, focusing very much on cycling and walkability, that is extensions of pedestrian pathways on the roadway, which is a low-cost solution as long as access is thought. So disability is mentioned in a very general way, and that's, well, it's a first step. However, the question is how to include disability on emerging sustainable mobility policies, considering transportation for students with disabilities to go back to school. Thank you.
Thank you, Janet. Margie, you wanted to comment on that.
I didn't want to comment. I just, I was on a teleconference yesterday with colleagues from the Child Health Initiative and UNICEF, and I know that they are working on a document, and I just found some information now online, and I think I'll copy and paste that into the chat. But the Child Health Initiative and UNICEF are about to release guidance on safe, healthy journeys to school during COVID. Which might be beneficial for the people asking about that question. I'm not sure if it addresses disability specifically, but I can actually highlight it to the colleagues I was talking to yesterday. If they haven't finalized the document, this might be something that they want to actually include in it.
Excellent. That sounds a very timely opportunity. Joseph, can I come back to you with the question specifically to you about Hong Kong and the way that you've dealt with COVID and what lessons perhaps for other countries from that, and particularly were people with disabilities taken into account in the steps that were taken there?
Unfortunately, I think I've recently had a conference call with a group of them, and they feel some of them are not not as well treated as they should be, but that's part of the Hong Kong government. But I think the main difference with the numbers are low around this region is because it's the way that we're using the mask as the defender, is a barrier. You can see within this region, now we had the SARS back in 2003, many years ago, and from then, the wearing of masks is a norm. It's nothing special about that. I think that's the problem. Was we had trouble finding masks when it first started back here in February this year. So, you know, you look at Macau and Taiwan, Japan, wearing of masks is a natural thing. And I don't understand why in some culture they think wearing a mask is such a difficult thing to do. Now, the material of mask can be washable, can be breathable, can be many aspects, and you've seen designs can be even transparent, you know, for the lip reading, etc. So I think one of the big things that helped us at the moment is the wearing of masks. And because social distance does not really work here, physical distance does not work, we have very congested, very densely populated places. We use the MTR underground all the time, and you can't have that 4 or 5 or 6 feet social distance. So that's sort of one barrier. I think that's the thing that's so far saving us. And I think our disabled has a number of issues to address with government. I think they need better services, they need better communication. I think some of the speakers mentioned tonight, it's applicable to Hong Kong as well as anywhere else. Thank you, Anne.
Thank you. Luca, back to you on questions. Yes,
there is one clarification from Luke Beasley. I don't know whether this is the same institution that Crystal has mentioned, but he was saying that there is an international disability network. It's called the Disabled Peoples International and is recognized by the UN.
Yeah, I think that there are a number of bodies there that could be hopefully drawn together to try and move forward on this agenda, so that before the next pandemic hits the world, we have properly built in responses and so on for people with disabilities, so we don't end up in the same mess. Luca, back to you.
There is a final question from Chris Cook, a PhD student from the Institute for Transport Studies at the University of Leeds. He's saying a question for Nick and Margie. Coronavirus is set to be with us for quite some time to come. We've heard a lot about long-term plans to improve accessibility in the future. But what practical steps can be taken in the short term to ensure that the views of and needs of people with disabilities are considered and addressed, so that as lockdown and social distancing are gradually eased, even greater levels of social isolation do not ensue? I think it's a big one.
Yeah, it's a big question there. You want to kick off on that? Nick, are you with us?
Yes, I'm with you. I'm with you. Yes, I just have to find the right button.
Right button.
It keeps moving around the screen. Okay, thanks, Chris, for that. That's as people said, that's a huge question. I think there's first practical steps. I think is we have to get the public to understand that people with disabilities have needs, and that they need to understand those needs. So a practical step, I think, is actually to go back to what Crystal was saying about the media, and we need to get that sort of action in very quickly to get better information more generally out there all the time. And I think that is a really crucial thing to do, because without that, other things won't be able to happen. I think making sure that public transport is as usable as possible for people with disabilities is to me is the bottom line. If we can get it right for people with disabilities, it will be right for other people. And I think that's the way round to think it, and that's certainly what we're trying to do in London. I think we do have to think about the long term, and I think now is a really good chance to do that. I think we need to get far better education of everybody in school about people with disabilities, so that that becomes the way that action happens in the future. Young students from school are very strong pressure points for adults that they interact with, and I think getting that into the way in which they learn things at school is a way of normalizing the fact that people are different, and that needs to be something which we don't think of people as different. We just understand that people have different needs and how to cope with them. And I think that is to me, that is the long term, but we have to start now with that. COVID is a great opportunity for demonstrating that, I think. And that's why we can take that step now.
Thank you, Nick. Margie.
Yeah, I mean, I think that was great, Nick. I think that I would only add maybe 2 points there. One, for academics like ourselves to actually think social inclusion, to think about designing our studies to include people with disabilities. You know, I don't think it's at the top of most researchers' agendas. I think it needs to be put there. So I think that those of us that have some awareness need to spread the message, so to speak. And then I think that people with disabilities and the organizations that represent them need to be more vocal as well in the media. I'm not sure that during the COVID crisis I've heard from anybody talking about the challenges that they have faced during the lockdown, and I think that maybe we need to put this to the fore. I mean, I think that there has been great community cohesion, certainly in the area that I live in, with people really rallying around people with disabilities, other vulnerable people, the aged, those that are shielding, immunocompromised, etc. So I think that there's a great sense of community in many areas. And I think that we have to capitalize on this, but I think that we have to put this out there as much as we can.
Okay, thank you for that. We're running fast out of time. I'm going to give Samuel and Crystal no more than 30 seconds each, just to give us a last thought, and then I'll do some very brief concluding remarks. Samuel, do you want to go first, but very briefly, if you would?
Yeah. We have been trying to bring forth awareness about the issues that we are facing, especially in the lockdown phase and in the unlock phase. The problem we are facing is that mainstream media is not very responsive to what we have to say. That is the problem.
Thank you for that. I think that's one of the key issues that's come up. Crystal, what would you like to say as a very brief conclusion?
Yes, here in Kenya, I think the media have been definitely trying to get people with disabilities on screen, in interviews, on the news, in primetime sessions on TV and on radio as well, for sure. I think maybe as well, the question from Chris Cook, I would also add to that is maybe trying to figure out a way to add universal design or designing for infectious diseases as some sort of core course in education in all these different disciplines regarding the built environment, whether that's engineering or planning or design, etc. Because clearly, as Maggie has said, we need more academics involved in this. And if there are young people who are coming up now into those careers, into those positions, then it should be in the curriculum. That might be, it might not be such a low-hanging fruit, but it's definitely worth considering for something that we should start taking in consideration from now.
Thank you very much. I see there are one or two questions we haven't managed to tackle, but as we said at the beginning, we will follow up on those afterwards. So thank you very much to those who asked the questions, and don't think you've been forgotten. I think this has been extremely interesting. Just in a few brief words of summing up, I think what we've uncovered is both some short-term issues and some longer-term issues. In the short term, trying to tackle the fear that exists and that is therefore affecting disabled people's possibility to move about and to go out of doors and to get the assistance that they need. So there are a lot of myths about infection and how infection is spread that need to be tackled so that people with disabilities have the better opportunities. We need to find practical solutions. We've touched on some of the technology ideas of, doors you don't have to touch, buttons that can be operated with something other than your hand. There's a lot of potential there, and my guess would be a lot of it is technology that exists. It just needs to be applied in that way. And we then talked about the longer term issues, and in particular, how on earth do we engage people with disabilities to make sure that the pandemic planning that every nation will now be doing against the next time we have this kind of issue engages with people with disabilities right from the outset, rather than as a jerk reaction right at the end. And I think we've come up with some very useful suggestions there about bringing together existing international disability organizations and trying to get a very clear established political framework within which those issues can be brought together. We could go on a lot longer than this, but I know everybody's got busy lives to get back to. Thank you all very much indeed to our speakers, to Samuel and to Crystal, to our panelists, Nick and Margie and Joseph, and to all of you who've stuck with us through the last hour and a half, and I hope you found it interesting. And there will be further follow-up, and I'm going to give the last word to Louise, who I see has popped up on screen. Louise.
Thank you, and thanks very much. And to all our speakers, we've really enjoyed the interesting perspectives, and as they've mentioned, and certainly as some of our attendees have mentioned, raising this awareness and keeping this this information at the forefront of everybody's mind is one of the things that's really essential to make sure that you know, people are not left behind or are not forgotten. HVT is doing some work in these areas. We are calling on the transport community to work together more collegiately, and also looking to publish with other partners information that can help beneficiaries of our program in low-income countries. So please stay in touch with the program if you want to know more about that. But we thank you very much for attending this afternoon. It's been brilliant. Thank you so much, and good day to everybody.
Thank you. Thank you all, and goodbye. Thank you.